Today, we're talking about anaphylaxis. It's one of the scariest medical emergencies out there, a severe allergic reaction that can go from zero to life-threatening in literally just minutes. So, what's actually happening inside the body? How do you spot the danger signs? And most importantly, what can you do to stop it? Let's get right into it. Okay, I want you to imagine this. You're the first responder. The call comes in, you're on your way to the scene, and all you know is that a 33-year-old man can't breathe. This isn't just a story. We're putting you right in the middle of the action, so you can see exactly how this unfolds. So you walk through the door, and the scene is just critical. The man is clearly gasping for air. You can actually hear a high-pitched wheeze with every single breath he takes. His skin, it's bright red and covered in these welts, hives. You can tell right away he can only speak in 2 or 3 word sentences. Time is already running out.
So what is happening to our patient? To really understand this emergency, you have to get what's going on with the science. And here's the key. This isn't an attack from the outside. No, this is a massive overreaction from the inside.
You see, an allergic reaction is basically your body's defense system going into complete overdrive. It mistakes something totally harmless, like a peanut or a bee sting, for a dangerous invader. And to fight it off, it just floods the system with chemicals like histamines, and that is exactly when the trouble starts. Now, it's really important to know there's a huge difference between a local reaction, like, say, a single itchy mosquito bite, and a systemic one. A systemic reaction, which is anaphylaxis, is a full-body crisis. It's not just the skin. We're talking about the airways, the blood vessels, the heart. Everything is under attack, all at once. This really lays out the chain reaction perfectly. It all starts with an allergen entering the body. Then the immune system just panics and releases this tidal wave of chemicals. And those chemicals are what cause all the chaos. They swell the airways shut and make blood pressure absolutely plummet. It's a rapid 4-step cascade right toward disaster. And how fast are we talking? Well, that fast. This number is just chilling. More than 2/3 of people who die from anaphylaxis are gone within just 30 minutes of exposure. This is not something you can wait out. Every single second is critical. So what could possibly trigger such a violent reaction? Well, the list of culprits is pretty long, but most of them fall into a few key categories that, honestly, you probably encounter every single day. Here they are, the big 5. Foods like peanuts and shellfish are a huge cause. Then you've got medications like penicillin, but it can also be plants, chemicals like latex, and of course, insect stings. It turns out our patient was just eating dinner about 20 minutes before his symptoms kicked in. Okay, knowing the triggers is one thing, but being able to recognize the body's SOS signals, that's what actually saves a life. So let's get back to our patient and break down exactly what we're seeing. His condition is deteriorating. He's now pale, his skin feels cool, and his lips are starting to swell up. His blood pressure is dropping to a dangerously low level. So, what are the classic must-know signs of anaphylaxis that are staring us right in the face here? This slide breaks all that chaos down into 4 critical signs. First, urticaria, that's just the medical term for those widespread hives we see all over his skin. Second, angioedema, that's the swelling we're seeing in his face and lips. That wheezing sound, that's our clue his airway is narrowing. And finally, hypotension, a dangerous drop in blood pressure that can quickly lead to total collapse. And then, he says this. He struggles to get the words out. I feel like I have a lump in my throat. You have to understand, this isn't just a feeling. That's the angioedema swelling his airway from the inside out. This is one of the most terrifying direct signs that the airway is closing. So, we've identified the problem, we see the signs, and the patient is crashing. It's time for the definitive intervention. There is one primary medication that can reverse this whole process, and it's called epinephrine. Epinephrine is an absolute powerhouse. It works by doing 2 critical things all at once. It constricts the blood vessels to get the patient's blood pressure back up, and at the same time, it opens up their airways so they can actually breathe again. Yeah, it can cause some side effects like a racing heart or dizziness, but in a life or death situation, those actions are what matter. They are what save a life. And this is the tool, an epinephrine autoinjector, what most people know as an EpiPen. The adult version delivers a 0.3 milligram dose. Don't worry about the numbers. Just know this is the first-line, #1 primary treatment to reverse anaphylaxis, period. So, how do you use it? Well, it's designed to be simple and fast. First, you pull off the safety cap.
Then you place the tip against the outer thigh, and you can even do it right through their clothing. Push hard until you hear that click, hold it there for 3 seconds, pull it out, and you're done. You've just delivered a life-saving medication. It's that simple. And the big question? Does it work? Just look at these numbers. Before the epinephrine, our patient's blood pressure was down at 88/60, and his oxygen was at a dangerously low 88%. Just 5 minutes after that one injection, his BP is up to 104/66, and his oxygen is at 95%. That is a dramatic, life-saving turnaround. The results are almost immediate. You can see his breathing get easier, the confusion, which was caused by a lack of oxygen, starts to lift, his wheezing improves. The intervention was a success. We've pulled him back from the brink. But wait, the story doesn't end here. Just because the patient is feeling better doesn't mean the danger has completely passed. And this leads us to the single most important thing to remember after using epinephrine. So here's the crucial point. Epinephrine is a rescue drug, it's not a cure. All it does is buy you time. The allergic reaction is still bubbling away in the background, and when that epinephrine wears off, the symptoms can come roaring back. That's why every single person who receives epinephrine for anaphylaxis must go to the hospital. Immediately. No exceptions. So, we've gone from a routine dinner to a major medical crisis and back again. We've seen just how quickly a body can turn on itself and how one simple action can completely reverse that course. So the only question left is, if you saw the signs, would you be ready to act? Now you know how.